All right, hi everyone. Thank you for joining us today for our daily Facebook Live. I'm Ashton Day. I'm a health educator here at the health department. And as always, we have our great interpreter, Shelby, with us. And then I'm going to go ahead and let our guest today introduce herself.
Hi everyone, I hope everyone's day is going great. My name is Kayla Weckenberg-Tomka. I'm the Environmental Public Health Supervisor here for Columbia-Boone County Public Health and Human Services.
Awesome. Long title, but you do a lot of important work here for us. And so today we are going to be talking about food safety and environmental health during the COVID-19 outbreak. Before we start, I know you have gotten a lot of calls from businesses during the stay-at-home order. I just want to let everyone know, if you are a business here in Boone County and you're not sure if you're considered essential or not, there is a form on our website at como.gov/coronavirus. So we encourage you to fill out that form, and then we will be in contact with you. All right, so we're going to get started here. So one of the biggest things, our local restaurants, a lot of them are doing delivery and to-go options. What can we do to ensure a contactless delivery with these types of businesses?
Okay, that's a great question. Obviously, the easiest thing you could do would be to order online and pay online and have that food delivered to your house. You could designate a drop-off location like at the end of your driveway or on your front porch where the delivery driver could go ahead and leave the delivery there. Not necessarily just for delivery, but sometimes there are establishments that are currently open. For example, a place or a person who is going to get food that may not be able to utilize the drive-through, that might have to go inside an establishment to pick up food or order their food, that is currently still allowed with this order. Under certain conditions, so social distancing does still have to be practiced. The establishment does have to have a plan or a method in place to make sure that social distancing is being done. So that can look like, X's on the floor or dots on the floor that are all 6 feet apart, where customers can stand while they wait for their order, and then once they receive their order, they leave at that time.
Awesome, those are great tips. So if I am getting carry out or delivery, is there anything I need to do to make sure the boxes and the bags are sanitized?
Okay, that's a good question too. So there is currently no CDC guidance that says that food delivery boxes or any types of bags need to be sanitized. We would encourage you to discard those after you've taken your food out of them. Or in the example, if it's like groceries, we would always say after you've unloaded all your groceries and put them away, to make sure that you're disinfecting your countertops after you've done that with an EPA approved disinfectant that is proven effective against COVID-19. And a list of those can be found on the EPA's website.
Awesome. Thank you for sharing that information, because I know as we learn more about COVID-19, those recommendations can change. So it's important to go to that EPA website for that information. So, a lot of people too have asked, should you be worried about getting COVID-19 from a food worker that's handling your food?
So if you're not in direct contact with that food worker, you're keeping your social distancing. There is no evidence from CDC that shows that COVID-19 is foodborne related or food related. So as long as normal hygienic practices are being practiced in the food establishment that they should be doing all the time anyway, there should be little to no risk.
Awesome. Good to know. And then what about is there any research out there that COVID-19 can live on the food?
Currently, there is no research that shows by CDC that we have seen, and we follow CDC's guidelines for everything.
Right.
So there's no current research that would show that COVID-19 is a foodborne illness or food related.
Right. So for those who still do work in the food industry and are helping with carryouts and stuff, should they stay home if they're sick?
Absolutely. We would require that. Actually, that's in the City of Columbia Food Code. If you're sick, then you should not be working when you are experiencing those symptoms. So this is really the same thing, don't work when you're sick, and that goes for any essential business right now too. If you're sick, don't go to work.
Right. We're going to stick with the food stuff for now. So how have you and your team adjusted to doing health inspections right now?
It has been a big adjustment for us. There are a lot of food establishments that are closed. just because they didn't have the volume of business. So, and obviously, we want people out of the public as much as possible. So when we are doing inspections, we are picking larger food establishments to go to make sure that we can maintain that social distancing. We are always responding to complaints as well. So if we get a complaint about a food establishment, or heaven forbid there was a foodborne illness outbreak, at this time we would still have our normal response to those complaints and those outbreaks as we always would.
Good. And then a lot of food donations have popped up around here. A lot of people want to help any way they can, especially when it relates to helping people who might have a hard time getting food right now. So how have you here at the health department been kind of keeping an eye on that and advising people?
Great question, and we have fielded a lot of those questions recently. We love that folks want to help, and honestly, helping right now is really no different than helping any other time. So any donations, be it cooked food or uncooked food, they all do have to come from an approved source. So cooked food especially, there are folks who want to feed kiddos that are not in school right now in the form of sandwiches. So anything that is prepared does have to be prepared in an approved kitchen, so an inspected kitchen by our Public Health and Human Services staff. There are a few exceptions to that. So if, for example, someone wanted to give away prepackaged, non-potentially hazardous snacks, that would be fine. So that might look like little bags of Teddy Grahams that are, in their package, or whole uncut fruits or whole uncut vegetables. Those are all things that would be fine. We have worked really closely with the food bank. We've worked really closely with local school districts, Boys and Girls Club, other local associations that are currently having food grab-and-go sites, to not only make sure that the food is coming from an approved source, but also to ensure that when the food is picked up, that proper social distancing is occurring during those pickup times.
Yeah, and just for anyone watching, if you do need help with food, that information is on our Get Help area of our website on como.gov/coronavirus. And so switching gears just a little bit, this order also had some information about childcare. I know you all have gotten a lot of questions. So I think a big one is, can only children of essential employees be using childcare right now?
That's a great question, and the answer to that is yes. So if you are a childcare provider, or if you're not a childcare provider but your kids are going to childcare, the only children that should be in childcare right now are children of essential employees, so people that are having to report to work daily. If you are not an essential employee, or you are watching children of parents that are not essential employees, those children should be home. Right. The purpose of the order was to keep people safe, keep people out of the community, and reduce exposure. So those children should be at home.
Yeah. I think that's a lot of the questions that people have been asking, and I don't see any on our comments right now. Was there anything else that I didn't ask you that you feel it's important for people to know?
I think it's probably the same thing that everyone has been saying this entire time. Wash your hands, keep your social distancing. At home, I would say you look at that EPA list of approved disinfectants, not a sanitizer, not a cleaner, a disinfectant that is proven effective against COVID-19. And I would say, look at that frequently, because as this situation evolves, the guidance changes. So the guidance we receive one day might be different than it is a couple days later. But really look at that guidance and contact times, especially for those disinfectants, because that's where you're really going to eliminate any spread in your household or among your, from any other sources.
Right. Awesome. Well, thank you so much for being here today and every day that you're doing work here at the health department. Thanks for Shelby for joining us. And just to remind anyone, if you have more specific questions about environmental health or food safety, you can email those to coronavirus@como.gov. All right, and we will see you all again tomorrow. Thanks.